So this is Hannes. Hannes is a patient who is planning to undergo a surgery for his nose, and he has a few questions to me, and we know each other for a couple of weeks and months actually. And yeah, please, Hannes, go ahead. Tell the audience what's your problem.
Yeah, so thank you for the introduction. So for the last years, I had like a lot of problems with my nose, especially with the breathing. So I had struggles, especially during the sleep time to get air through my nose. So like in the end, I just breathed through my mouth, which caused a couple of problems. And the main problem I experience in my life that I often get sick, although I have like a really healthy lifestyle, right? I take care of my food, of my sleep, I do sports, but even though I do all these things, I got sick often. And they made some research, and I know that I have some problems with my nose. So I knew, okay, the next step is going to you and check myself. And you made or you saw the problems probably, right?
Yeah, but for other people, to help people who hear this, what was the most bothering, or what is bothering you the most?
I would say first the brain. I have a lot of brain fog, especially during the morning times. So even though I sleep 8 hours and I take care of my sleep quality, I wake up and I have brain fog. Like I really like dizzy and headache and not feeling good, which is kind of weird, right? Because like at some point I was like, okay, that's normal, that's me. But then I was like, okay, what? No, wait, that's not normal. Why should I have headache all the time? That makes no sense at all. So this was one thing, and the other thing that I got sick really often, which was at some point disrupted my quality of life.
And you also said that you felt that your immune system is down.
Yeah. So
how did you feel this?
So first of all, the fact that I get sick really often, and the second one is that really often, if I compare myself to my friends, I'm more tired overall, I would say. And I think that's maybe one reason is that the immune system is maybe really active all day long, which causes a lot of energy, right? Which takes a lot of energy. And I feel that I don't feel that active most of the time.
And what was it that we found? In your case, what is the special thing that happens to you that makes you puts you in this situation?
Yeah, like you said, right, that my nose is not like, I don't get enough air through my nose because the anatomy of my nose is not in a optimal position, right?
Yes. So like we have two eyes, we have also two noses, and we only see that we have two nostrils, and there's a wall in the middle, and this wall in the middle defines the size of the two nostrils, or basically how the two nasal passages are. And if it is not in midline and shifting to one side, it makes the one side more narrow, and at the same time the other side more wide, and that leads to a disbalance of the two noses, and that is the beginning of a problem.
Yeah, and what is the end of the problem, what you also saw in my case?
Yes, in your case also I saw that you have a sinusitis, and that was basically sequelae of this deviation of your nasal septum, which led to swelling and flow problems and eventually to a chronic inflammation, and sometimes it leads to allergies and sinusitis, sometimes only sinusitis, and it's always these three key points: the anatomy, the allergy, and the sinusitis. If they come all together, then it's the most difficult to treat, because whatever you try to treat will not be enough to fix the other problems. So We had to take this all in consideration, and that's why we are planning to do a turbinoplasty and a sinus surgery for you.
Yeah.
More questions?
Yeah, like after the surgery, like 10 days after surgery, I have like a lot of work to do, and I think a lot of people ask themselves, how intense is this surgery? How many days you need to take off? How long does it take? Do you need to do some preparations?
This is very kind of you to ask this, because it's really good and it's helpful for other people. Maybe we get the chance to make one more video after the surgery. We should really consider that, because what's going to happen is either way, I have to put some dressing inside your nose. I'm using the mildest possible dressing, which is a cellulose sponge, and that sponge needs to claim the space of the nasal pipe and make sure that it stays open, yeah? That nothing of the, let's say, loose anatomy will claim this space, or no swelling or so. And that needs to be there for a week. And that goes along with with a few little problems. Problem number one is the nose. Obviously, everybody knows when you hit your nose. Everybody knows that when you hit your nose, you tend to bleed. Yeah, the nose is very, very much blood circulated, and obviously after surgery, it's also the same, and that doesn't dry out because of the sponge. So you will have a little bit of, let's say, sometimes some oozing coming out of your nose, yeah, and that's it, yeah. And the second thing is that you can't breathe because it's blocked, yeah, with the sponge. But we are using some silicone tubes that we add to this, and the silicone tubes are open enough to guarantee you nose breathing. However, it doesn't feel like nose breathing because it goes through the tube, yeah?
Yeah.
But at least you can use the same passage, and we encourage the patients to rinse these tubes as soon as they are fit to go to the washroom and sniff some water through the tubes. And that's it basically. So the obstructed feeling, yeah, and the necessity to rinse your tubes, and then the oozing. Oozing usually stops after 2-3 days.
Okay. Is it painful after the surgery?
No, there's no pain. It's just discomfort. And the good thing is this material, this cellulose material, is sliding out very easily from the nose. There is no bandage, no painful removal of anything. Also, you can really expect it to be a huge relief to get it out. Yeah, so it's a little bit like somebody has a broken leg and has to wear a cast, and then the relief when the cast comes off.
Yeah.
But there will be no outer signs. Yeah, so nothing visible, no cuts outside, also nothing that disturbs the outer shape of your nose. The shape of our nose is anyway only the tip of the iceberg, because the nose reaches until the ear, yeah, through the skull, yeah, and back to the throat, yeah, and it's like 10 centimeter deep inside. So the 2 centimeter of nose are just. Are just a beauty feature.
Makes sense. All right.
Yeah.
Like, I also wondered, actually my girlfriend asked that to me, does like the overall shape of my nose from the outside, is it changing, or is it only the inside?
It's only inside. Nothing outside. If you want to change something outside, you need to deliberately do additional work.
All right, that makes sense.
So it's very unlikely. I mean, there is a risk for extensive septum surgery that is done also then in a wrong way, where somebody, let's say, if the surgeon jeopardizes this kind of point where the cartilage is the flexible part and the bony part, where they are connected, if the surgeon for some reason disconnects this or makes it very weak, then people can develop a saddle nose. But To be honest, I've never seen it, and I haven't even seen any of my colleagues causing this. So it's extremely rare that this happens.
Yeah. One more question, like in the past when I were in Germany, for example, I also made some checks. But like the problem was, first of all, I felt like the doctors don't take enough time for myself, and second, like the appointment for the surgery was like a month, like 10 months in advance, because the health system in Germany is a bit bad. And well, I also wonder, because I felt like when I was in your clinic, you took a lot of time, made a lot of checks, and also I made the CT, is it the right word?
Yes, CT scan.
And I feel like, what would you say, how can you recognize a good doctor for this kind of surgery? So what's the things you should be aware of when choosing the right doctor?
Oh, well, this is a question that's a little bit difficult for me to answer, but I can say you were talking about the system. It's a system. Obviously, if you see the patient in the operation theater and the last time you saw him was 10 months ago, then you're not operating the patient, you're operating a nose according to a script that you have been given, and that is then the patient is a number, yeah? And that's definitely not good. It's not healthy, and I doubt that this can be of any benefit for a patient, to be honest. I doubt that, yeah, unless there is a severe septum deviation or so, a severe sickness, which is in either case better after surgery. Yeah, but I would never do this. Yeah, I would never go for such a surgery. And then yes. When it comes to medical, to quality, to delivering quality in medicine, we need to understand many things. One of that is that, look, how many times have I seen you now? Maybe 4 or 5 times, and you see yourself since birth every day. Yeah, who knows more about you or me? Yeah. So I need to get as much information from you as I can to identify your problem. And especially if it is something that is elective, that means we can choose what to do, then I need to be 100% sure that this is really your problem. So I need to listen a lot to what you have to say. How can I know? Just from your smile or from your face or so? Yeah, it's difficult. That's number one. Number two is because it's your body and not my body, and I'm the one who's just holding the blade in his hands and is doing this actual work. It's still you who has to do the major work. You have to go through the entire post-operative procedure. You have to somehow internally align your body with what's happening and prepare yourself for that, because at the end a surgery is a teamwork between not only the surgical team but also the surgeon and the patient. And how can that work if you haven't explained everything in detail to the patient so that they know why they shouldn't do this and why they should do that after the surgery? Yeah? Yeah. And I tend to talk a little bit too much and overload my patient with information to understand why it's going to be like this and that, and maybe that is too much, but better too much than too little.
Yeah.
And that's how I see it. If you can determine who's a good or bad doctor from that, I don't know. Another thing is just go on Google reviews or so and check out if many people are genuinely happy with what the surgeon is doing or not.
Yeah. You said to me, because of course the surgery is something that you tend to put it in the future, right? Because it's never the right timing somehow. So I felt that for myself, and you said to me, hey, listen, it's not gonna be better with your nose, it's probably gonna be worse and worse year after year, and like the earlier you do it, the better it is. So maybe you can explain to me and to your audience again, what is the mechanism here and why probably now is the best timing to do such a surgery?
Oh, that's very easy. If your case is about life quality, yeah, and indeed that particular diagnosis that we found out in your case is not going to be better. Yeah, we tried medication and it didn't work, and you tried medication before, so it's pretty clear that it's not going to be better from alone. On the other side, it is not a matter of life and death, and you don't have to do it right now, but then you continue suffering. And every person needs to set their own priorities. What is the most important thing in their life? Yeah. Sometimes, if a surgery is not covered by insurance and they have to pay it from their own pocket, money plays a role. Sometimes time plays a role. Sometimes fear plays a role. In general, I would always say do a surgery or regard a surgery like a bungee jump or something like this. You would only do it when you're ready. You need to be mentally ready. Now is the time that I'm going for it. And that's usually the best time to do a surgery. It doesn't matter if it's summer or winter. It doesn't matter if it's if you're busy at work or not busy at work or so. You yourself, you need to feel ready.
Also, something you said to me is like that the nose breathing can get worse over time.
Sure.
And that was also a thing maybe that I think I didn't know that, and I think a lot of people don't know that. And you also said to me like the surgery is probably gonna be more difficult over time, and or it's like not that easy right now because now it's like minor, right?
Yeah. This is in general the case. So with these chronic things, they worsen. Yeah, they get worse year by year, and the implication that it has for you also gets worse continuously. And there are so many factors, like you mentioned already, the sleep, for example, the sleep quality, the immune system that is, let's say your immune system is affected by the sleep quality. That again has an implication on your reaction to your sinusitis, to your inflammation in the nose, which makes already the inflammation in the nose harder to tackle for your body, plus makes the possible allergies harder to tackle. And like this, you get already, let's say, it's getting more and more expanded into your head, the disease. And on the other side, also the nose has a particular feature that it never stops growing. So we know that from the simple thing, if you ask a child to draw a picture of a witch or a wizard, they will always draw a wizard with a long hooked nose, which indicates the 250 years old wizard, because the nose has been growing all the time and going forwards, downwards, and we know it's ancient knowledge that the longer the nose, the older the person. So indeed the growth of the nose is around 0.1 millimeter per year to the side if it's a septum deviation, and that means in 10 years you have 1 millimeter. And if you have only 4 millimeter size, then you
can do the math.
You can do the math. And since there are some physics laws which are actually where the exponent, or where the radius is exponent 4 in the equation, and especially the law with regards to resistance of a pipe, then it is pretty clear that that even minor changes have a big impact on the resistance. So all of that together makes the breathing more difficult, and then maybe from sucking on your stomach, you get a hiatus hernia, then you get more and more reflux, then you get a larynx problem, and so on. It piles up. Yeah. Let's say if you have a car with a tire that is not aligned properly, yeah, and you continue driving with it, it's not going to get any better. Yeah. So with you cannot hope that this after 10,000 kilometers it will be better. Yeah, that's probably the best example, and you're using your body, and that's why it's going to be worse.
Well, I also like experienced like in our pre-checks we made, because I'm like a really analytical guy, right? Mm-hmm. And the way you explain me, and I think that's pretty interesting for a lot of people to understand the math behind the airflow, and that you can basically, it's not possible for me to get enough air through the nose. So it's mathematically with the volume of air I need, it's not possible to get enough air, and we checked that, and I think that's really interesting, maybe also for people to understand.
Yes, it is, but I am there a little bit on thin ice, because obviously you have a shallow breathe when you're sleeping. You're not filling the entire lung. Mm-hmm. Let's say you have a lung capacity of 5 liter and we breathe every 10 seconds. That would mean you need to get 5 liter in, 5 liter out. That means you need to move 10 liter. That means you need to move 1 liter per second through the nose in and 1 liter per second through the nose out. And then we can measure how many milliliter are passing through your nose, and if at the pressure that you apply when you're sleeping, you get only 250 milliliter through both nostrils, then you know definitely you will not be able to fill the entire lung. However, it may be that you're not consuming so much air, so much oxygen, because everything is hibernated during the sleep, so you will be probably fine if you fill only 2 liters, if you have a shallow breathing. Yeah. But still, we are dreaming, we are going into REM phase and so on, and then we need sometimes more air. And there is no publication that really tells us how many liter we are filling the lung. But clearly, if the restriction is already there, we can see from what's happening that obviously the deficit of breathing that you run into, or that you are obviously running into a deficit because you are forced to open the mouth and breathe through the mouth, and you are forced to go out of the hibernated slow wave sleep into a shallow sleep to just be able to take a deep breath. If that happens, it's an indirect proof that the math was right. Yeah, but this is not yet scientifically proven. Yeah. So I just like for people who are analytical to show them, look here, this is basically the math behind it.
Yeah, makes sense. I mean, like the body, it's kind of gives you an indication, right? Because obviously I'm breathing through my mouth and not through the mouth, through the nose, so kind of makes sense. Yeah.
And in our previous take, I explained to you how the mouth is specialized only for food. Yeah. And the nose is super specialized to secure our exposure to the air. As I said, we are not aware that we are actually living in a gas environment, which is our air, our atmosphere. And this atmosphere is like the ocean for the fish. It's our ocean which we are swimming in. And if you are 1 meter 80, you have a body surface, let's say, of 1.8 square meter. And your lung, if it's a 5 liter lung, you have a 100 square meter lung. So where's your exposure? It's in the lung, yeah, because this is 100 square meter. Yeah? This is completely different to the 1.8 square meter outside. So your nose with the two nostrils is the actual security organ to protect you from the environment.
My gatekeeper, yeah.
Your gatekeeper, exactly. It's protecting you from any risk that comes from the atmosphere.
Yep.
Which you're living in.
And we have more and more through the urbanization, right? So we definitely need that in our days right now.
Yes, exactly. So our atmosphere is probably not that good everywhere. Although I think it's still okay. Can be worse.
Yeah.
Can be worse.
I think it depends also. When you live in the city, you have obviously more things that you don't want to have in your body, right?
Yeah. Yes. Too much nitric oxygen, is quite an inflammation from that. It's quite common. Anyhow, it was very nice talking with you, Hannes. So we can make that video. We will. I will give this to our editor. Probably the German version I will give you unedited, and you can edit it yourself. Yeah, it's probably better, because I think the editor doesn't speak German. He will not understand when to make a break. So then I see you for the surgery. When do we do the surgery?
On Wednesday next week.
Okay, so you still have time to think.
Yeah. Maybe I
I have a policy. Once I was supposed to have a surgery, and I was in that operation theater, and I saw some cables hanging out of the ceiling, and then I saw, I don't know, I didn't, all of a sudden I completely lost my trust in this theater, and everything looked so weird, and the people were weird, and I was lying there half naked on that bench there on the surgical table, and then I said, guys, stop, I decided not to do it.
Oh, crazy.
They were really, really angry with me. The anesthesiologist was shouting with me, and the nurse was shouting, and it was a very uncomfortable situation. I thought at that time, I will never, ever let my patients come into this situation if they want to go. It's your body, yeah? You are the captain of your body, and if you decide not to go for it, it doesn't matter when, yeah?
Yeah.
I will be your advocate.
Yeah, that makes sense.
It's better like this.
Grateful for that.
So, yeah, that's how we do it.
All right.
Okay.
Thank you. Looking forward to it.
Yes. Okay. Thank you.